Welcome to Mission College News at 9, Special Health Segment. I'm Candy Swiper.
And I'm Jameson Whiskey, bringing you the special report on CAD.
Now, in case you didn't know, CAD, also known as coronary artery disease, also known as heart disease. In CAD, we have two major distinctions, angina and myocardial infarction, better known as heart attack.
Heart disease is the number one cause of death in the USA.
More than 787,000 people in the U.S. die from heart disease, stroke, and other cardiovascular diseases in 2010. That's about 1 in every 3 deaths in America.
That's astonishing, but that's why we're here, to help you get the scoop and find out what we need to know to protect yourself and keep you healthy.
Here to help us explain, it's our special guest, Dr. Angelina, who's specialized in cardiology.
Please welcome Dr. Angelina.
Thank you for having me here today.
Our pleasure. My understanding of CAD is pretty limited, and you're a leading specialist. I know it affects the heart, but really, what should I know?
Well, Candy, heart disease is one of the biggest health concerns we face today. Like you said, it's one of the most common causes of death in the United States. And it's important to know it can affect everyone, the elderly, young, and all nationalities. It doesn't discriminate. The American Heart Association gauges the cardiovascular health of the nation by tracking 7 key health factors and behaviors that increase the risk for heart disease and stroke.
Oh wow, you've got me intrigued. Tell us more.
Well, first we need to understand heart disease and blood vessel disease because it includes numerous problems, many of which are related to a process called atherosclerosis. Atherosclerosis is a condition that develops when a substance called plaque builds up in the walls of the arteries. This buildup narrows the arteries, making it harder for blood to flow through. And if the blood is still able to pass through, it can still supply the heart, but it might be diminished by that narrowing. Because of that narrowing, symptoms can still occur, which often mimic a heart attack, but it's this process commonly known as angina. And statistically speaking, it's often a precursor to a heart attack or a stroke. Now, a heart attack occurs when the blood flow to that part of the heart is actually blocked by the clot or an occlusion. If the clot cuts off the blood flow completely, that part of the heart muscle supplied by that artery begins to die due to that lack of oxygen and perfusion. And the biggest difference to note is that with angina, there's no tissue death, while in a heart attack, there will be a degree of tissue death.
So doctor, can you tell us some of the symptoms to be on the lookout for when dealing with this disease?
Well, sure. Heart disease can present itself in many different forms. The most classic way is with the complaint of chest pain in the center of the chest. Oftentimes, it's sharp or stabbing in nature, which can radiate to the neck, back, jaw, left arm. It can even present itself as indigestion, nausea, vomiting. The symptoms can be very subtle, but also very varied, like fatigue, weakness, difficulty breathing, fainting, or lightheadedness. One difference between angina and a heart attack is that typically when resting, your body requires less oxygen. And with angina, the pain can come on when doing any physical activity, but it can be relieved with rest. With a heart attack, that's just not the case. The pain is usually constant and isn't relieved by anything. However, if you're concerned, the best option is to seek professional help and talk to your doctor. And if severe enough, call 911 or go directly to emergency room.
Now, is it true, doctor, that most people who survive their first heart attack can resume their normal lives? Does having a heart attack mean they have to make dramatic changes in their life?
Well, yes. Certain lifestyle changes are going to be a key component in getting healthy and staying healthy and living that longer, fuller life, and definitely in managing these symptoms.
That's a great point, which brings us to our number one reporter, Pad Thai, on scene with a member of the public who has some experience with CAD. Let's see what they have to say about this.
Now I'm here with a member of the public who entertain tell of her personal experience with CAD. This is myoglobin who in 2010 decided to follow up with her doctor regarding her constant state of fatigue and weakness, thinking it was going to be a simple checkup for cold that just wouldn't go away. After the initial evaluation with the doctor, he immediately direct myoglobin to the ER for further testing. So, myoglobin, can you please explain in your term what happened?
Oh, well, I had been feeling out of sorts for a few weeks when I finally decided to see my doctor. He was obviously concerned enough to see me to the ER. While in ER, the physicians there did a variety on testing on me, primarily due to the fact that heart disease runs in my family, and they were really concerned.
So, what kind of testing did they do?
They did an EKG to check electrical conductivity to see how my heart was functioning. They also draw blood to evaluate my cardiac enzymes, CK, troponin, myoglobin. These tests are sometimes called heart damage markers, as well as a chest X-ray to evaluate the shape, size, and placement of my heart. There are other tests that they can do, like a stress test, echocardiogram, cardiac catheterization, angiography, CT, MRI, but the ones I had are the most common, which screen your heart and help the doctor determine what treatments and lifestyle changes will keep your heart healthy and prevent serious future medical events.
So, what was your final diagnosis?
I was diagnosed with CAD. Specifically, I had a myocardial infarction.
So, is there cure?
There is no cure per se, but treatment for coronary artery disease usually involves lifestyle changes and, if it's necessary, drugs and certain medical procedures. Drugs such as nitrates, opiates, statins, thrombolytics, and beta adrenergic blockers. Also, as soon I went to the ER, whatever I received right away was oxygen, um, morphine. Uh, Besides, I have sit down and with pillows on my back, so try to elevate it and be comfortable. I could breathe easily. And nurses, they told me they have a nursing diagnosis, acute pain.
That's pretty involved. Can you describe some of the change you met in your life?
Oh, my biggest change revolved around quitting smoking. But I also had to make changes in my diet by eating healthier and coming up with exercise routine. When I exercise for at least 30 minutes a day, I also made a plan to lose weight. Look at me now. And reduce my stress level. But what really helped me was having a cardiac catheterization and angioplasty, where they place a stent that opens the vessels to allow more blood flow to my heart.
Oh, that sounds like you have made some big change in your life to prevent any further complication from CAD or any other serious medical event related to your condition. That's fantastic. Is there anything else? Is there anything else you think that the public should be informed about?
One of the biggest things that helped me was knowing where to find resources. I asked my doctor and searched the internet. The American Heart Association, CDC, and the Mayo Clinic and the Red Cross were very, very helpful. They have resources like diet tips, information on medical treatments, preventative medications, and exercise regimens.
Oh, thank you very much for your share experience. So now back to the station.
Wow, it all started with thinking she had a cold.
I know. Isn't it great that Maya Globin went to see her doctor? Many just don't know when to seek help. Hopefully, with this news segment, many others experiencing any of the symptoms reported earlier will seek medical attention.
We also wanted to thank Dr. Angelina for her expertise on the subject and for joining us today.
Yes, thank you very much.
You're all very welcome. It was my pleasure, and anything to spread the word regarding heart disease.
All right, and coming up next, sleep deprivation in nursing students on the rise.